Hi. Yeah, hi.
Let's talk.
What the heck?
Hi, and welcome back to Pocketbook Pediatrics. I'm Dr. Richland Brown, and if you've been joining me, you know I'm always so happy to have you here with me. And if you're new, I'm happy to have you too. And I hope you'll find something useful today and that we'll see you again. So, today we're going to be talking about influenza, or what is more commonly called the flu virus. So, it's a viral illness, and there are different types of flu that we can come about. So, you might hear about types A, B, or C, or you might hear some numbers thrown in there. So, you hear H1, N1, H3, N2, and you might wonder, what's that all about? And it really is just telling us about different types of flu and different parts of the flu family. So, think about the Brown family, you have grandma, daddy, uncle, daughter, and it just tells us which one of them is around right now. And that's important because the flu virus, like COVID-19, has in the past caused pandemics, and so it has the potential to cause pandemics again, and that is infection on a worldwide basis. And it has also been responsible for many deaths in the past, depending on which one of these baddies is causing the problem. So that's why you might hear in the news they're talking about the different types of flu, just so that we know what is happening in our environment right now, which one is causing the problem. That's important because some types of the flu are more contagious, or meaning they're passed more easily from one person to the other, or what we call catching here in Jamaica. And some cause more severe disease than others. So it's good to know what's happening around and what type of flu is causing the problem. But flu is a virus after all, and generally it's going to cause some of the symptoms that other viral illnesses cause. So it's going to cause things like fever. But the difference with this fever is that with the flu, sometimes the fever can last about 5 days. Usually with other viruses, the fever tends to cut off by about day 2 or so. So this is a difference that can be useful for your pediatrician to know if it is the flu that your child has. And then there might also be some headaches and muscle pain and body pains generally. There can also be some sore throat. There can be cough and runny nose. And in children particularly, there can also be vomiting and diarrhea. So these are things to let your pediatrician know so we can come down to a diagnosis. Now, I know you're smart ones out there and you're going to say, well, Dr. Brown, you just said that many viruses have the same types of symptoms. So is there any way that I can know for sure that this is the flu? Is there any way to diagnose that this is the flu and not something else? And yes, there are viral tests that can be done to let us know if this is the flu virus. So like COVID-19, there are rapid tests that can be done, and they give you an answer in about 10 to 15 minutes. But sometimes they're not as accurate as we'd like them to be. So for the most part, yes, they are accurate. But sometimes they can give you a positive answer when it's really negative, or a negative answer when it's really positive. So there are even further tests that can be done. But really, whether or not it will be necessary will be dependent on your pediatrician's discretion. Because the truth is, the flu is generally a mild illness for children. And so doing the further testing may not really add to how we're going to move forward with how we're managing your child's illness. So talk to your pediatrician and see if they think it's necessary. Now, having said that the flu is generally a mild disease, we do also still need to take into consideration that sometimes there can be other complications or other problems associated with the flu. Now, the flu is generally an upper respiratory tract illness. It affects things above the lung area. So you may have an ear infection or a sinusitis, infection of the sinuses, as a complication of the flu. But sometimes, even more seriously, you may have a lower respiratory tract infection or the involvement of the lungs, and you can get a pneumonia or a chest infection. So what are the things that we needed to be looking out for if there might be a pneumonia on board? We needed to be looking to see if your child is having any difficulty breathing. So are those little ribs becoming more visible? Are the muscles sinking in? Is the child breathing fast or looking like they're just working very hard to get a breath in? Is there any blue or purple color to their lips or their skin? These are all reasons to go and talk to your pediatrician. We also have to think about things that are related to the vomiting and the diarrhea. Is there any dehydration on board that is getting out of hand? So is your child vomiting and not able to keep things down? Are they very, very irritable and you can't console them? Are they difficult to awaken? Are they having some confusion? Those are all reasons to go and talk to your pediatrician. We also have to talk about at-risk groups, or children who tend to have a weaker immune system anyway because they have some other long-standing illness on board. So we think about kids who may have diabetes, who may have sickle cell anemia or heart disease, or who may be receiving chemotherapy for cancer or may have HIV. These are children who, when symptoms start and they seem to be going on, they shouldn't be watched for a long time. You should really take them to your pediatrician to make sure that everything is okay and there's nothing else that needs to be done. And we also have to talk about if there is a rash. Now remember, we've spoken about before, fever and rash are not a good combination. So if you see that happening, definitely take your child to be seen. Now, the management of flu is definitely going to be mainly symptomatic treatment. What does that mean? Basically, we treat whatever symptoms your child has. So if we're talking about the fever and the pain, we're going to give fever and pain medicine. And that's going to be acetaminophen that we want you to give. So that's Panadol, Cetamol, Tylenol. That is an appropriate medicine for fever and pain in flu infection. We do not want you to give aspirin. That can cause an even further problem, quite severe in your children, particularly when they have influenza infection. So if you have a medication at home and you're not quite sure, just call your pediatrician, ask them if it is an appropriate medication to give while your child is having symptoms of the flu. We also want you to give lots of rest, lots of hydration, and remember, antibiotics are not appropriate because the flu is a viral infection. Sometimes antibiotics may be given for that pneumonia if the doctor does diagnose that they have that as well, but on a whole, antibiotics will not be useful for the treatment of flu. And I know you're smart cookies and you're going to say, well, what about antivirals, Dr. Brown? Are there antivirals that can be used? And the answer to that is yes. Again, this is dependent on the discretion of the pediatrician. Antivirals usually are brought on board for more severe disease, so they may not be needed for your child. But you can ask your pediatrician and they can let you know whether they think it's necessary in the treatment of your child. We can also talk about vaccination. And again, I know you're my smart cookies and you're going to say, vaccination? I thought vaccination was useful for prevention, not treatment. And that is very true, and we're going to talk about that very shortly. But it can also be helpful in the early part of a disease, within the first 48 hours or so. It can help to reduce the severity and the length of the illness. So vaccination is good there. But let's talk about vaccination as prevention. Now, vaccination is encouraged for anybody who is 6 months old and older who can receive the vaccine. And why do we say that? You might say, Dr. Brown, you said it's a mild disease. I don't know if I want to subject my child to getting a vaccine for mild disease. But remember, children don't live by themselves, and there are adults who they may be living with who are in an at-risk population. So adults who have HIV, or adults who are receiving chemotherapy, or who have sickle cell anemia, and they need to be protected too. We also think about not just what's happening in our family, but remember we spoke about before the worldwide stage. So if we prevent influenza in our child, it's helping our community, it's helping on the worldwide stage as well. And then there are also adults and children who may not be able to take the vaccine for themselves. And when your child gets vaccinated, your family gets vaccinated, it helps also those who can't get the vaccine for themselves. So we do encourage that everyone who can get the vaccination gets the vaccination. Now, the vaccination is applied yearly, and you may say, a yearly stick, Dr. Brown, but yes, it's necessary because, as we said before as well, there are different strains of influenza. And so each year that changes, and each year the vaccine that is produced is to help to protect against the ones that are causing most of the problems. So every year we suggest that you get the vaccine. Now, when do you get the vaccine? So there is generally a flu season in most countries. In the tropics here, you can get flu pretty much any time of the year, but we tend to see more infections happening or starting around October to November, and then most of the infections between December and May. So we're on the end of our flu season here in Jamaica. So we suggest that you get the vaccine as soon as it is available to you, but at least hopefully by the early part of the season, by about the end of October. All right, so that will be helpful in treatment. Now, there are different preparations of the vaccine that are available, and you can talk to your pediatrician about whether the injection or the intranasal, that's in the nose preparation, is appropriate for your child. And we also talk about side effects. Every vaccine is going to have side effects, so you can talk to your pediatrician about those as well. Remember that vaccines can't 100% prevent any disease. We can't promise you that, but it does help with prevention in many. And if you do happen to come down with the flu, it can also reduce the severity of the disease and the length of the disease. So it's still worth getting. So of course, the vaccine is not the only way that we're going to help to prevent the flu. There are other ways that we can as well. And that includes staying inside if you are sick. So we're going to prevent the spread to other people. And if someone else is ill, we're going to avoid contact with them until they're better. Lots of rest, lots of hydration are also very useful. We also have to talk about hand washing, which we're also very familiar with right now, and sanitization with our alcohol preparations. That's going to help keep our hands clean. We have to talk about cough etiquette as well. Teach your kids the right ways to cough and the right ways to sanitize their hands afterwards. Now, I know we're also growing very wary of hiding our faces, but masks are still going to be very important in preventing the spread of flu, even as COVID-19 dials back. And we have to think about, again, those who are at risk, who have a weaker immune system. This is going to be very important as well for them. We want you to reduce contact with your eyes, your mouth, and your nose as well as much as possible. And of course, we talk about diet and exercise. This is going to be so important in boosting your immune system. So get your kids outside playing and get their plates full of all the colors of the rainbow. This is really going to help them to have an immune system that can fight back when they're met with anything, not just the flu. So that's all we have for you in Pocketbook Pediatrics today. I really hope that this has been informative for you. You understand the flu better, you understand the when and why of the vaccines better, and hopefully you'll be first in line when the vaccine becomes available to you. Thank you so much for watching. I look forward to seeing you the next time on Pocketbook Pediatrics. God bless.